The novel coronavirus doesn't discriminate.
It's not about red or blue.
It infects people of all ages and races.
It's about Americans, and it's about Texans, and it's about lives.
And yet, Domingo Garcia, national president of the League of United Latin American Citizens, says the pandemic is hitting some Texans harder than others.
And statewide emergency for Latinos here in Texas.
The Tarrant County Public Health Department says Hispanics make up 30% of the county's population, but 39% of its COVID-19 cases. In Dallas County, Hispanics make up 41% of the population, but 57% of positive cases.
There is a disproportionate impact.
Liz Cedillo Pereira is the chief of equity and inclusion for the city of Dallas. She says one explanation is cultural norms.
Multi-generational households where the abuelita, the grandmother, is living with the family. So that's an issue related to density.
Latinos are also more likely to work in frontline and essential jobs that don't provide workers with health care,
such as food and agriculture, public works and infrastructure.
To address the disparity, the city of Dallas is launching a new COVID-19 testing site at the Mexican consulate starting July 8th, a Latinx task force with community leaders, and a resilience fund for immigrant residents who don't qualify for federal stimulus funds. But as COVID-19 cases continue to rise in North Texas, Garcia says more needs to be done for all Texans.
We need to make sure that everybody is provided health care, including undocumented immigrants. They are your neighbors, and they need to be taken care of. If not, they will get other people sick and continue the community spread.
In Arlington, I'm Eric Alvarez.